Hello guys, I'm talking about infections. Uh, AIDS fevers. A medical student has made some language notes on a case report. Case 45. A 20 years old man present with a fever which he had had for 3 days. On the third day, he had had a severe attack of fever with sweats and rigors. The only past history of relevance was hepatitis for years, early and glandular fever. Infection with Epstein-Barr virus at the age of the 80 years old. He has returned from Africa 3 weeks previously. Fever, pyrexia. Also remember PUO, pyrexia of unknown origins. Fever, also known as a temperature, even got up temperature, adjective, uh, fe- feverish, febrile, and pyrexia. Opposite of febrile, apyrexia. Some symptoms of fever, sweating and rigor, severe shivery, and sensation of coldness, also known as a chills. Microorganisms. Infection differ from other diseases in a number of aspects. Most importantly, they are caused by living microorganisms, such as a virus or bacteria that can usually be identified, thus establish the etiology early in the illness. Many of these organisms, including all bacteria, are sensitive to antibiotics, and most infections are potentially curable only unlike unlike many known infections. Then degenerative and chronic disease, communi- communicability is another factor which differentiates infection from non-infection disease. Transmission of pathogenous organisms to other people directly or indirectly may lead to an outbreak or epidemic. Finally, many infections are preventable by hygienic measures by vaccines, especially live attenuant vaccines, such as a rivulet vaccines or by drugs prophylaxis. For example, chloroquine to prevent malaria. Microorganisms including bacterial, virus, fugit, protozoa, so as the parasite that cause malaria. Another general word for this pathogen is microbes. Patients often refer to microbes or hermits or birds. Notice that the common expression for acquiring an infection disease. Could he has catch, pick it up some disease from the dog? I think even cat the flock bug that's going round. Sodas, and spread an infection. Here is an extract from a medical textbook. Infection may originate from the patient endogenous, usually from skin, nasopharynx, or backgrounds of from outside sources exogenous after another person who may be either suffers from an infection or carry a pathogen microorganism. Carriers are usually healthy and may inherited organism is the draw, for example, diphtheria, bovine salmonella, or blood, hepatitis B or HIV, now human sources of infection, including water, e.g., cholera, milk, tuberculosis, food, and botulism, animals, rabies, bears, psittacosis, and also the soil legionella, legionnaire disease. The incubation periods is the period between the invasion of the tissues by pathogens and the appearance of the clinical feature of the infection. The period of infecting is the time that the patient is infectious to others. In Spanish, um, infección, fiebre. Un estudiante de medicina ha hecho algunas notas de lenguaje sobre un informe de casos. Caso 45, un hombre de 24 años presentó fiebre que había tenido durante 3 días. El tercer día tuvo un ataque severo de fiebre con sudoración y escalofrío. La única historial clínica relevante fue hepatitis 4 años antes y fiebre glandular, infección por el virus de Epstein-Barr a los 18 años y había regresado de África 3 semanas antes. Términos relacionados que son la fiebre igual a pirexia, también se recuerda PUO, pirexia de origen desconocido, fiebre también conocida como temperatura, tengo temperatura, adjetivos febril, piréxico y su opuesto a febriles o apiréctico. Algunos síntomas de fiebre, sudoración y escalofrío. En microorganismos, las infecciones se diferencian de otras enfermedades en varios aspectos. Principalmente son causadas por microorganismos vivos como virus o bacterias que generalmente se pueden identificar estableciendo así la etiología temprana de la enfermedad. Principalmente estos son causados por microorganismos vivos. Muchos de estos organismos incluyen todas las bacterias, son sensibles a los antibióticos y la mayoría de las infecciones son potencialmente curables, a diferencia de muchas de enfermedades degenerativas y crónicas no infecciosas. Comunicabilidad en otros factor que diferencia las infecciones de las enfermedades no infecciosas, la transmisión de organismo patógeno a otra persona directa o indirecta puede llevar un brote o epidemia. Finalmente, muchas infecciones patógenas a otras personas directa o indirecta puede llevar a un brote epidemial. Finalmente, muchas infecciones se pueden prevenir mediante medidas higiénicas, vacunas, especialmente vacunas atenuadas vivas como la vacuna contra la rubiola o vacuna especialmente o vacuna como la profilaxia farmacológica, por ejemplo, cloroquina para prevenir la malaria, y los microorganismos incluyen bacterias, virus, hongos, protozoos como el parásitos que causa la malaria. Otra palabra general para estos agentes patógenos es un microbios. Los pacientes a menudo se refieren a los microbios como gérmenes o bichos. También se mencionan algunas expresiones comunes para adquirir una enfermedad infecciosa. Podría haber contraído o recorrido alguna enfermedad del perro. Creo que he cogido el virus de la gripe que anda circulando. I think I've been catch the flu, but that going round. Sí, sauce, fuente y propagación de la infección. Aquí se presenta un extracto de un libro de texto médico. En este habla sobre las infecciones, que la infección puede originarse en el paciente endógena, generalmente de la piel, nasofaringe o intestino, o de fuentes externas exogenadas, a menudo de otras personas que puede estar sufriendo de una infección o ser portadora de un microorganismo patógeno. Los portadores, los portadores carriers suelen estar sanos y pueden albergar el organismo en la garganta, por ejemplo, difteria, o el intestino, salmonela, o en el intestino, por ejemplo, la salmonela, o la sangre, en la sangre, que pueden ser la hepatitis P o el VIH y otras fuentes no, no humanas de infecciones, que estas incluyen el agua, cólera, la leche, tuberculosis, los alimentos, botulismo, los animales, rabia o citocosis, y también el suelo, legionela, enfermedades de la legionarios. También el periodo de infectividad es el tiempo que el paciente es infeccioso para los demás. And the shapes of 25 mental illness. Psychiatric disorder. A psychiatric disorder can be divided into organisms and functional. Dementia is a mental disorder due to the organism's brain disease. The common the commonest form of dementia is that associated with other age. Senile dementia disorder in which there is not obvious pathology or anatomic change in an organs are termed functional. These are described below. B. Sustained abuse. Abuse sustains means using in a way that hurts the components from of sustained abuse are alcoholism and drugs abuse. An affecting disorder. Here is extract from a medical textbook. Affect is mood are symbols in minutes and refer to the emotion. For example, happiness or sadness. Affect tend to be used for temporary emotion. It is spread through manner or speaking, facial expression or behavior. Moods is used to refer to a more permanent emotion state. The most common form of affecting disorder is depression, the symptoms of which are poor appetite, of significant of weight loss, sleep disturbance, for example, insomnia, inability to sleep, fatigue, loss of energy, physical motor, agitation, exercise, movement, and those of psychomotor retardation, slowing of movement and thought. Love and interest are stimulated activities, disgrace ability to think and concentrate, feeling that one is of no value to others, or that one has done sometimes roles, record through of die or suicide, fire possible far forth of the evil symptom occurring nearly every day for at least 2 weeks. Constitute a major depression, neurotic and stress-related disorder. An example of neurotic disorder is obsessive compulsive disorder. And obsessive is an idea that is so persistent that interfered with the patient's life. A composition is an obsessive idea that forces the patient to act even though they recognize that is unnecessary. A common form of this composite washing of the hands stress is feeling of being unable to cope. It can last to anxious or fear of problems as others. Attack of anxiety is called panic attack. Other type of function disorder, these include behavioral syndromes associated with past physiological disturbances, so as eating disorder of adult personalized and behavior, for example, personality disorder, mental retardation, delayed mental development, schizophrenia, and other disorders in which there are delusion phase beliefs. And shape number 26, the nervous system, sensory loss. The central nervous system controls the sensory and motor function of the body. Disease of the symptom therefore leads to loss of some of these function, hearing, seeing, sensation, feeling, balance, loss, deafness, bleakness, numbness, anesthesia, unsteadiness, ataxia. Other symptoms, bruising or ringing in the ears, tinnitus, double vision, diplopia, blurry, loss of vision, acuity, clarity of vision, Tibly of pins and nails paresthesias. Dizziness, vertigos, motor loss. Motor loss symptoms and signs include weakness, loss of power, paralysis, complete loss of power, tremor, involuntary rhythmic movement, especially of the hand, abnormal weight, unusual manner of walking. Speaks may also be affected, for example, with hoarseness, although the voice, as is vocal cord paralysis. Slurred speech means for poor articulation, as in several diseases. Loss of consciousness. Patient may describe sudden loss of consciousness in a number of ways. I pass out, I have lack of, I faint, I have a fit, I have seizure, I have a convulsion. Fit, seizure, and convulsion are all used to refer to violence involuntary movement, as in epilepsy. Dr. may say, when did you lose consciousness? Here passengers from a textbook of the cause of lost consciousness. The principal difference diagnosis is between an epileptic fit and syncopal attack. Of fitting syncope is sudden loss of consciousness due to temporary failure of the cerebral circulation. Syncope of distinguished from a seizure principally by the circumstance in which the event occurred. For example, syncope usually occurs with steady under situation of severe stress in association with an arrhythmia, sometimes, and a convulsion and urinary incontinence. Loss of control of the bladder occur even syncopal attack, though neither of these is specific for epileptic attack. The key is to stability, the presence of a set of prodroma symptoms or symptoms that occur immediately before the attack. Syncopal episodes are usually preceded by symptoms of dizziness and lightheadedness in epilepsy. People may get a waning knows as an aura that attack is going to happen. Note, the nose convulsion is often used in plural form. He has convulsions as a child. En Spanish, el sistema nervioso o pérdida sensorial. Number one. Pérdida de función o pérdida sensorial. El sistema nervioso central controla las funciones y motoras del cuerpo. Enfermedades de ese sistema pueden causar la pérdida de algunas de estas funciones, como por ejemplo la pérdida de función, audición, sordera, vista, ceguera, equilibrio, inestabilidad, ataxia, inestabilidad o ataxia, sensibilidad, adormecimiento, anestesia. Pérdida motora. Las enfermedades del sistema nervioso también pueden afectar el control motor, debilitando el movimiento o causando espasmos. Otros síntomas: zumbido o pitido en el oído, tinnitus, que esa es de la audición o sordera, visión doble, que esa es vista y ceguera. En esta podemos ver que otros síntomas serían la diplopia, visión borrosa o disminución de la agudez visual, que esta es equilibrio, inestabilidad o ataxia. También hormigueo, sensación de aguja, parestesias, que en esta podemos ver que es la sensibilidad o adormecimiento o anestesia. Esta podemos ver que va a haber un hormigueo, sensación de aguja, parestesia y también por último balance, mareo y vértigo. Pérdida motora, motor loss. La pérdida motora puede incluir debilidad, disminución de la fuerza muscular o pérdida del poder, parálisis, pérdida total de la función muscular, temblor, movimiento rítmico involuntario, especialmente en las manos, manchas anormales, alteraciones en la forma de caminar, también afecciones al hablar, loss of consciousness, antes de eso, afección al hablar, ronquera, voz áspera o profunda, como en la parálisis de la cuerda vocal, hablar arrastrado, dificultad para articular palabras, frecuente en enfermedades cerebelosas. También pérdida de la conciencia, loss of consciousness. Los pacientes pueden describir una pérdida súbita de conciencia con términos como desmayo, colapso, convulsiones, ataques epilépticos. La diferencia entre síncope y crisis epiléptica es que el principal diagnóstico diferencial es entre síncope es la pérdida temporal de la conciencia por una falla de la circulación cerebral, común al estar de pie en estrés severo o por arritmia, puede acompañarse de convulsiones y pérdidas de control de la vejiga, y crisis epiléptica generalmente procedidas por un aura, una señal de advertencia que indica el inicio del ataque. Y también la nota podemos ver que en convulsión se utiliza en plural, se dice que él tuvo una convulsión cuando él era niño. In tapes number 27, the Norse 7, the nervous system to the motor system examination. The motor system should include assessment of the following: muscle bulk, amount of muscle tissue looked for signs of wasting, muscle atrophy, muscle tonus, all amounts of tension in a muscle when it's relaxed, relaxed tone can be increased spasticity or discrete flaccidity, muscle power, strength, coordination, the ability to use several muscles at the same time to perform complex actions, weight the manner of walking, reflex be below involuntary movements, for example, a tick or tremor. Here in extract from case report about patient with tremor. Case 18. An examination. He faced shadow little honor or no expression. There was a tremor affecting mainly her right hand. She has general increased muscle tone, power, reflex, coordination, and sensation were within normal limits. Examination of her weight showed that she was slow to start working and have difficulty stopping and turning. Tender reflex. Examination of the nervous system normally include testing the tender reflex. For example, they need years with a tender hand, also known as a reflex hand. The reflex may be a set of zero diminished minor normal plus and bridge plus. The plantar reflex are also checked. The normal plantar response is a dual coin. Scroll down, movement plantar down, and movement plantar flexion of the big toes as ongoing toes extensor of big Van Biskin response in a normal. Comas is unconscious with a reduced response response to external stimuli. Doctors say the patient is in a coma. The patient is comatose. The Glasgow Coma Scale GCC score is calculated as follows: opening, ears opening, spontaneous, 4 to speech, 3 to pain, 2 and no, 1 verbal response, orient, confused, inappropriate, incomprehensible, knownness, orient, 5, confused, 4, inappropriate, 3, incomprehensible, 2, and knownness, 1, motor response, obeys, 6, localized, 5, withdraws, 4, flexion, 3, and extension, 2, and other ones. This is the first time of the video.